Hello anatomy colleagues, this is Dr. Alsup and we are going to work our way through the nerves that we need to be able to identify for the anterior neck and thorax session. So we're going to start with the nerves that are more associated with the neck and then we'll move to the thorax, starting with the accessory nerve or cranial nerve 11. Now recall, cranial nerve 11 is going to efferently innervate the sternocleidomastoid. So sometimes it's helpful to kind of identify the muscles, as well as the trapezius muscle. So you can see this is the trapezius on the back. Here's that rope-like sternocleidomastoid. And in this particular image, the sternocleidomastoid has been reflected. You can just see a little bit of the trapezius. And the accessory nerve, at least in terms of how we would assess, we would always want to be able to see it between the sternocleidomastoid and the trapezius. So it is this small nerve right here that is between the sternocleidomastoid and the trapezius. These are going to be more of those fibers from the spinal nerves. You can really nicely see it here on this image. I'm going to outline it right here. And so you can see it clearly going between the sternocleidomastoid and the trapezius. What is unique about the accessory nerve in comparison to some of the other nerves is that it has almost a coiled appearance. So it's kind of squiggly in comparison to some of the other nerves that we will see. And it's on a little bit of the larger side. These nerves right here are going to be nerves of the cervical plexus that are more afferent fibers. But again, that anatomical relationship that is key for accessory is you can see that is going to be between the sternocleidomastoid and the trapezius, and it is on the larger, more squiggly side. Next is the Ansys Cervicalis. The Ansys Cervicalis, I hope you recall, is going to be innervating the strap muscles, or those infrahyoid muscles. So the hyoid is going to be right here. Your strap muscles are going to be over in this region. And the Ansys Cervicalis is typically found either within or on top of the carotid sheath. And in this particular dissection, the carotid sheath has been removed, but you can see carotid sheath content. So here's your common carotid. Your vagus would be deep, and the internal jugular vein. And I'm going to outline where your Ansys Cervicalis is. You can see it's this really pretty loop around this region, then you kind of lose it back here. And you can see some of it, the muscular branches of Ansys Cervicalis heading to those strap muscles. So close relationship to the carotid sheath contents, but a superficial relationship. And then, of course, it's going to be this nice loop with some muscular branches heading towards those strap muscles. The vagus nerve, or cranial nerve 10, will be our good friend throughout the year. It will keep kind of popping up. It is going to exit the jugular foramen in this region, and then it will descend through the neck region as part of the carotid sheath content. So again, we're looking at a slightly different dissection, but here is the common carotid artery, so very nice, very large in the neck region. Here's your internal jugular vein. You can see a bit of that Ansys Cervicalis that I'm outlining right here. And then here is the vagus. And the vagus for a nerve is quite large. It's usually going to be intermediate and deep in terms of its location within the carotid sheath. So you can see the carotid or common carotid's medial, the internal jugular's lateral, and here's that vagus nerve kind of in the middle of those two structures and deep. Lastly, we'll move down towards the thorax region. You are going to have your pectoral nerves that are going to be associated with the pectoral muscles. Kind of getting our bearings in terms of which one's which. This is going to be the pectoralis major that has been reflected in order for us to be able to see the pectoralis minor and the neurovasculature in this region. Recall that both the medial and the lateral pectoral nerves are going to innervate the pec major, and only the medial pectoral nerve will innervate the pectoralis minor. And another key anatomical relationship when we're talking about the medial pectoral nerve is that it is going to pierce the pectoralis minor. And what I mean by that is that literally it will kind of go in between the muscular fibers of pec minor. And you can see that here and here. So these are both branches of the medial pectoral nerve. And you can see that it's also extending up and heading towards the deep side of the pectoralis major in order to innervate it. It's a little bit more difficult to tell which one of these is going to be the lateral pectoral nerve, but it's going to be this one right in this region. Now keep in mind, in a practical setting, we would ask you to identify the nerve or say the artery, so you wouldn't have to differentiate between which one's the nerve and the artery in these neurovascular bundles. But you can see that it is heading towards the deep side of the pectoralis major, and it is not piercing the pectoralis minor, so that seems like that is a good indication that we are looking at the lateral pectoral nerve. All right, excellent. So those are the nerves of the anterior neck and thorax that you are going to need to be able to identify and understand those anatomical relationships. Please take your time to review, and as always, if you have any questions or clarification that you need, please always feel free to reach out to myself or any of my colleagues. Thank you for your time and attention.